Very special guest joining us in studio this half hour of the program. And Russell Singleton was last year, I think a couple of weeks ago, or maybe 3 weeks ago, Russell. You and the doctor have sort of been playing musical chairs coming in and out of the building.
That's right. We love to be here, but we also love to take care of people back at the clinic. So we try and leave one of us back there to
It is
hold down the
busy
fort.
there. It is very busy there.
Absolutely.
There's not much time to sit down and take a break any longer, from what I understand.
No, there's not. We have an incredible number of new patients coming in, and yet we try and reserve as many spots as we can for those same day appointments and for people who need to get in quickly. We hate to make people wait, and we try not to make people wait for appointments.
Of course, you're always looking for new patients too, as well, and we have so many newcomers to the Twin Falls area. That if someone is looking for a doctor, and people move sometimes. The cable guy who came over and installed at my house came here from San Francisco. People like that always are going to need someone that they have to find for that regular medical care.
Yeah, this is good old-fashioned family medicine. We do just about everything. There are very few things we don't do in the clinic. We have a great relationship with a lot of our local specialists, and if it's something that we don't feel comfortable managing or can't manage, we find someone who can. But I think we're a first stop for pretty much everybody.
We'll talk a little later about how you can contact the office. In fact, if you're looking to find a new doctor in the area, but in the meantime, I want to point out Better Health with Tripp Family Medicine is a weekly event here between 8:30 and 9 o'clock on the program. And if you have a question or comment, of course, for the physician assistant or the doctor when they're in studio, the telephone number is 736-0300. And of course, Bill Colley along for the ride too today on Top Story on News Radio 1310 KLIX, as well as you can listen to us online at newsradio1310.com. You're speaking today about mental illness, and I have a small confession. I've had a number of family members who dealt with either depression during their lives. It used to be called manic depression. It's been given different names over the years,
Hmm.
reclassified and the like. But I mean, it was obvious that they were struggling, and it affects their lives and their ability to succeed in so many different ways. And we all seem to know someone who at one time or another goes through this.
I think you're right. And if we don't know someone, we probably are that someone. The statistics are out there, and it is amazing how prevalent this is, how ubiquitous mental illness can be. At any one time, 20% of Americans, so 1 in 5 Americans, have some sort of mental illness at any given time. We can talk about the lifetime prevalence for things like depression or anxiety. If you want to start talking about the prevalence of mental illness in certain groups, like those that have substance abuse disorders or the homeless, those in the correctional system, the numbers are staggering. So I agree with you. This is a problem that has to be dealt with. It's a significant detractor to to quality of life.
Over the years, we've heard, someone will say, well, that person is nuts or bats or loony. And so we tend to discredit them by throwing those names around like that. We wouldn't say that about someone who had cancer or cardiac disease or pulmonary, some sort of problem like that. We never give it that type of derogatory nickname.
I'm really glad you mentioned that because I'd like to address that, but it just reminds me of a funny thing that my father said. He said, really, today no one is just cranky or belligerent anymore. They're bipolar, and I think that is true in one regard. I think we're quicker to label things that maybe we shouldn't. But at the same time, what you say, Bill, is incredibly important. We cannot downplay the effect that mental illness can have in a life, in a family. Um, and without a correct diagnosis, there's no chance at correct treatment. So I completely agree with you there. I think we need to really focus more on helping people rather than labeling people, and trying to be more accepting of people than trying to draw a divide between us and them, because as I was saying before, we are them, they are us. All of us at some point will go through something like that.
We've come a long way too, in the sense that over the years we used to treat people with lithium and other type of drugs, but treatments have gotten much more sophisticated over the course, at least of my lifetime.
Yeah, I think that's true. We do still use lithium, though,
Hmm.
actually. Um, I don't think enough people place, uh, what's the right word here? I don't think enough people emphasize counseling enough. Now, surely medication Management has come a long way. We have new medications. We have better medications. We have cleaner medications. But therapy has come a long way as well. And if I could get even half my patients that I treat for some sort of mental illness into therapy, into a structured type of therapy, we would have so much more success. But there's unfortunately such a stigma with counseling, with mental health in general. But going to a counselor is a hard thing for a lot of people to do.
Yeah, and we were coming up on a break, first break of the half hour. But in the meantime, let's talk a little bit about that, maybe some more, because it does take some convincing sometimes with people, and it may not always happen the first time out. But sometimes it's a bit like trying to kick smoking. I had a friend who did it 17 times before she got it right.
Hmm.
So there's a persistence that needs to take place here too as well. We've got more coming up with Russell Singleton. He's a physician assistant at Tripp Family Medicine right here in Twin Falls. They're located on Fillmore Street, directly across from the main post office. We're talking mental health issues. We've got some more details on that coming up in just a few minutes. And if you have a question or comment for the PA while he's in studio, feel free to give us a call. It's 840, it's 64. You're listening to Top Story as well on News Radio 1310 KLIX and newsradio1310.com. Our studio guest is, not doctor yet, uh,
PA.
PA. But, it's funny in medicine because now you have PAs, you've got nurse practitioners. There are so many different divisions of people who are now working in medical practice. They weren't there when I was a kid.
Well, I think that's true. And you've got nurse practitioners and PAs that are also doctors. They have doctorate degrees. I think the most important thing to focus on now is just that we're a team. That
Provides care.
Yeah, and I believe that right now the team is led by the physician, but we're all important members all the way down to
Some
our.
of you are the receivers. He's the quarterback, and
Yeah, I think that's a great
yeah.
analogy.
Football season's on the way.
Can't wait.
We're talking mental health issues with Russell Singleton this morning. He's joining us from Tripp Family Medicine here in Twin Falls, and of course, Bill Colley with you as well. And of course, you can reach the program on News Radio 1310 KLIX and newsradio1310.com by calling us at 736-0300. And I believe we have a caller, Russ. Just want to point out 845 and 65 at our studios, and you're on the air.
Hi. Hey, I've got a question for you. My wife has a drinking problem, and she's been trying to address it. I tried to get her into some treatment centers, but she also has other medical problems where she has to take pain medication. And so the treatment centers, not naming names, but they won't let the patients in. And so I wondered, when I was a kid, my grandfather used to take this stuff that would make him sick if he drank. Does that still exist?
It does. It's called antabuse. And the funny thing about that is it does work. If you take it and you try and consume alcohol, you will become violently ill. But it doesn't take a lot for a person to realize, if I don't take this, I can drink and not get sick. So it I don't think it really plays a big role in treatment these days, but alcoholism is a very serious condition. Painkillers can be quite addicting too, but to detox from opiates, from painkillers, is a horrible thing to go through, but it is not fatal. Alcoholism, on the other hand, can be if you detox without treatment.
Want to thank him for the telephone call. And there is a relationship here because I had a friend many years ago I worked with, and he was a heavy drinker, and his doctor told him, he said, you're self-medicating, because he had never dealt with issues losing his mother when he was a little boy, that he had suffered from anxiety, depression, and the like. So there's often a tie between mental illness and alcohol abuse and the like.
Oh, I completely agree. I was reviewing some statistics on the National Institutes of Health, and one number I found interesting was that 40% of people with a diagnosable substance abuse disorder have some type of concurrent mental illness. So I think you're right. People recognize the need for treatment, for medication, but they go about it all the wrong ways. During the break, we were talking a lot about stigma that prevents people from getting the care they need. And because of that stigma, some people will self-diagnose and self-treat. I have friends and family that have gone down that path, and it's incredibly frustrating and heartbreaking to see that.
Because it's one of those illnesses you don't want to often acknowledge because you're concerned about how you'll be perceived in the neighborhood or by family. And
Absolutely. I think a lot of folks don't even want to acknowledge it to themselves. They've been strong, stoic individuals their whole life, but things build up, the body, the mind wear down, and they come to a point where they can't go on, and yet they're the first ones who can't accept that, who can't recognize that.
there's some physiological relations here too, though, because people who often go through life depressed are going to have more issues with perhaps heart disease and things like that. We often see them dying younger. That there's an impact.
25 to 30 years. If you have a mental illness, a serious mental illness, you're likely to die about 25 years sooner. Absolutely.
And we were talking in the break. You point out that the real goal now in medicine is to treat mental illness like you treat any other illness at this point.
When I'm talking to a patient for the first time about their depression, and I'm trying to convince them to pursue treatment, they're often very reluctant because of the personal stigma, because of the community or societal stigma, and I have to go through this with them. I ask them, would it be fair to criticize someone with diabetes, saying something like it's not normal or it's not healthy for you to need insulin every day just to feel good? And of course, you would never say that. That's crazy. Um, Mental illness is the same way. You can't tell someone that it is not normal or not healthy for them to need depression medication in order to feel good. These are both legitimate medical conditions that require legitimate treatments.
We have another caller looking to join us, and you're on the air with Russell Singleton. He's a physician assistant at Tripp Family Medicine in Twin Falls. And your question or comment?
Oh, mine is a comment. I have never really suffered with depression until I got into my 50s, probably from all my head injuries in my youth. But it was amazing that once I come out and started talking to some of my friends about it, how many of them were suffering from the same thing and wasn't doing anything about it. And what got me to do something about it was after 3 of my friends committed suicide for that reason. People need to wake up. There's no need for you to go through life feeling down. There's no need. It's liberating to finally go to a counselor and find out why am I pushing myself so hard that it's making me feel this way. And then with a little medication and an understanding of why, it changes your life.
Thank you. I could not agree more. I think that's a wonderful comment. Thank you very much.
And he brings up a point. Once he got to be 50, he started seeing it. And a lot of times people in older age, and I think a lot of this is because you lose friends, hey, you lose your looks. You lose a lot of things. And it becomes more and more difficult then to relate to that world around you.
It absolutely does. But by the same token, we see a lot of these conditions developing quite early in life. Another statistic, about 75% of the folks that will suffer with a mental illness during their life usually have it present by their late teens or early 20s. So I completely agree that this does particularly affect older individuals, but it's with an ever-increasing frequency affecting younger and younger individuals as well. And when I talk to some patients that I have and I hear about the situations they come from, I often ask myself how I could ever come out of that same situation without some type of maladjustment, without some type of distorted way of thinking or perceiving the world.
I did not play football long enough, I guess, to really. We used to call it getting your bell rung. It was thought to be somewhat funny that you'd get hit on the head. You smack somebody with your helmet, and the next thing you know, you're walking around trying to clear your head out. But when he brought up the fact that he had some of those issues when you're young and you get concussed at times, and we've seen this with a lot of professional ball players after 15, 20 years of that, they also suffer from a great deal of that emotional stress and that depression.
I agree. There's nothing you can really do to prevent a concussion either. If you're playing a contact sport, you're going to get a concussion at some point. you go out and play football, and I did, and I loved it, but that helmet does not protect you from a concussion. It'll protect you from a skull fracture, maybe it'll keep you from breaking your nose, but if you have a sudden acceleration and a sudden deceleration, you've got this what we call coup and counter coup movement of the brain. You're going to sustain a concussion, and it just amazes me how we're doing a lot of sports physicals right now as we prepare to go back into the school year, and it just amazes me how many student athletes have had 1, 2, or 3 concussions and they're still coming back. And I have to tell them and their parents that I do not recommend they continue to play, but they still do.
You can't really predict it though, because Steve Young, who had multiple concussions, retired to avoid any more. And you see him on TV now. He doesn't appear to have any issues from it. There may be some, but there may not be manifesting in any great way. But some other people, they've had a history of them too, and they break down afterwards.
It's true, and I think after you sustain one concussion, you will uh, be more likely to sustain another. So the longer you keep playing, the higher the stakes become.
Now, when it comes to treating people with mental illness, we've all known people who they'll take medication at times and then they'll stop because they say, "Well, I feel better. I must be cured."
Yes. Yes.
What do you do in that situation?
If I had an answer for that, I think a lot of our patients would do so much better. But I see it all the time. I see people who struggle. They start doing well on medicine, and then they say, "Well, life is better. I'm going to get off the medicine." Now, sometimes I think that's a legitimate option. A lot of cases of depression will actually resolve within a year. So to be on medicine for a short amount of time and then to try and come off is very reasonable if you work together with your doctor or your PA. But too many people, especially people with serious conditions, we were talking about legitimate bipolar disorder earlier on, when they stop taking their medications, they are in a world of hurt, or they're going to be, because these symptoms can be dangerous. A lot of folks with bipolar disease end up in the hospital, and that's how they get diagnosed. Is they're hospitalized for these types of outrageous behaviors, and finally we determine that it was because of bipolar disorder.
We have people who also apparently are dealing with a psychoses that will develop. And I think about this story out of Nampa the other day, where a woman was a passerby thought she was trying to drown a toddler in a canal, and she says now she was told she heard a voice that said baptize the child, uh, and so we have someone who may have been manifesting this anyway, but sometimes people just snap, don't they?
Yeah, thankfully that type of condition is rare, but it does happen. The things I see on a daily basis are ADD, ADHD, depression, anxiety, insomnia. I have a lot of patients who come in not understanding they might have a mental illness, but their complaint is back pain. They're fatigued. They don't sleep well. They have gastrointestinal complaints, whether it's chronic constipation or diarrhea. They suffer from poor sexual health, and there's that mind body connection that they don't yet understand. That I often bring up. Well, you might be depressed, and they say something like, no, impossible, I'm not sad. Well, sadness is not the only presenting complaint, and sometimes it's not even the chief complaint. Irritability I see probably more often than sadness.
If I had a GI issue, I'd be sad. I just that would make me sad in that situation. You want to remind people too, again, that we were talking about the fact that you're looking for new patients. How do they get a hold of the office?
Well, I think the first step is to give us a call at 933-4400. We love to have people follow us on Twitter or on Facebook, and we will see you as soon as we can. We try and keep spots open for same-day appointments. We think that's incredibly important in our day and age and in our community to have that type of access to your healthcare provider when you need it, not 2 or 3 weeks later.
And again, if someone is suffering from mental illness, you can refer them even on to someone else who might be able to give them that counseling and that treatment.
Absolutely. We have a lot of community partners that we work with. There are some excellent counselors in this area. And there are some excellent mental health specialists too, psychologists and psychiatrists. Unfortunately, there aren't enough of them to go around. And when we need to refer complicated cases, we do, but the wait can sometimes be 4 to 6 months. And so it is critical that you get into your primary care doctor, your family medicine doctor, and you start doing something, because the alternative is oftentimes just unacceptable, doing nothing.
We have to wrap up in about 30 seconds, Russell. Uh, just a quick reminder, you're doing sports physicals this afternoon, right? 3 to 6?
We are, absolutely. Give us a call. Just stop in if you have to. We'll take care of you.
And that is a great service, and you're doing it again, I think, next Wednesday, too, as well.
We are. That is correct. And we give a portion of the proceeds back to the program from where the athlete originates. And that's really why we do this. It's really not a moneymaker, but it's more of a community service.
It's one of the reasons the staff is expanding there, too, because sleep deprivation can be an issue, too, in your health, and these guys are working all the time. So
you are right again.
We'll chat with either you or the doctor, I'm sure, next week.
That's right.
I want to wrap up this edition, in fact, of Better Health with Tripp Family Medicine. And again, they're located on Fillmore Street, directly across the street from the main post office. Coming up on 8:59, and news as well at 9 o'clock from the Fox Radio Network. One more hour of the program ahead. And I know that people out there, some of them won't like this, but yes, you will hear the name Donald Trump somewhere in the next hour.